Welcome to COVID-19 Local Impact Peterborough. I'm Dan Malta at the Your TV Peterborough studios. On today's show, we'll get into detail about today's public health address. We'll also hear from Prime Minister Justin Trudeau a little bit later on in the show. Also, local businesses today. Barry DeVolen from Travel Maven Tours, and from Peterburgers, Roy Asseltine, the owner of a family company in Peterborough. But first, let's head to the public health address from earlier today in downtown Peterborough.
So we now have 7 confirmed cases in Peterborough, and that's an increase of 2 since we last were together. The 6th case reported to us yesterday evening is a female, 65-year-old. She's a resident of the city. And her exposure is connected to the nursing home in Bobcaygeon that has a COVID outbreak. She has 1 close contact, and she is at home and is self-isolating. And then we learned a few hours ago of a 7th confirmed case, a male in his 20s. He is a contact of another case from outside of Peterborough, and he also is at home and self-isolating. So none of our confirmed cases are hospitalized. They all remain in self-isolation. I just would like to give you an update on the numbers of tested in Peterborough. We're up to a total of 455 people that have been tested. We tested 11 ourselves here yesterday, and we have 16 people with appointments for testing today. We have 186 confirmed negative and 282 where we're still waiting for results. I know the media has been very interested in the situation with the swab shortage, and so we did get some good news this morning. We will be receiving an additional 200 swabs, so that'll see us through a good week there, and we had 63 swabs in our inventory this morning. As far as any new public health measures that we're undertaking, I think everyone is aware that non-essential services were required to close at midnight last night. We have been following up with some of those non-essential services, and we will provide an opportunity tomorrow for a shared media briefing with our enforcement partners, so we can go through some of the details about how this will be enforced and what role each of us will play. We're also working today with a select number of local childcare centres that will be reopening under provincial direction to provide childcare for essential workers like healthcare workers, and our role will be to ensure that infection control measures are being followed. So before I pass it over back to Brittany, I just want to say a final word, and that is that you will notice a change in our language. We will be using the words physical distancing as recommended by the World Health Organization instead of social distancing to describe the measures all of us should be taking to create a space between us so that we don't share the virus. And this change in wording is in recognition of the need for us to find ways to continue to remain socially connected, even though we are maintaining a physical distance. As people who work in the media and who use the word, I know you will understand the reasons for this change, and so I look forward to reading about physical distancing in your coverage of the pandemic. So I'll turn this over back to Brittany now for some further comments.
Thank you, Dr. Salvatierra. So we are making our Wednesday scrums open to our municipal partners to share a few words. So I would like to invite Mayor Therrien if she has any updates that she would like to share regarding the COVID-19 response for the city of Peterborough. Go ahead, Mayor Therrien.
Thank you, Brittany, and thank you. I'd echo Mayor Mitchell's words as well to all of the healthcare workers and everybody that's working through this crisis. There's folks, cashiers and folks providing other services during this time, and the media as well for covering this and getting the information out. We don't have any real new updates at this point from the city. Our emergency control group continues to meet each day, monitoring the situation and figuring out next steps from here. Again, we're just trying to highlight and encourage that stay home, practice that physical distancing piece and getting the word out, as was said, to particularly folks returning from abroad, that they need to adhere to those practices as well. And, we're all in this again, together and apart, and we'll continue to, figure out how to move forward during these difficult times. So thank you to everybody involved, and that's it for me for now.
Oh, okay, thank you, Mayor Tarian, and hopefully you can stay on the line in case there's some questions after.
Yeah, absolutely.
Great, thank you. And so I'd like to open it up to County Warden Jones to share the county's perspective, please, on COVID.
Okay, thank you very much for including the county, and as Dan said, we are all in this together, apart. And Rosanna, I'd like to personally thank you for your dogged help here in not letting this go. You've been doing just a great job, and I'll echo all the thanks we can possibly give to everyone out there who is doing their job. As of Monday at 2:41 p.m., the county officially declared the state of emergency, and of course that was done for many reasons. But I guess personally, the way I look at it is, it's very much symbolic. What it's saying is that the county of Peterborough takes this seriously, because there are people out there who still do not get it. I'm getting anecdotal reports virtually every day. People just don't seem to understand this. So what a state of emergency to me means right now, although it may mean all kinds of great things down the line, is that we're taking it seriously, and people have to understand that we mean business and we have to adhere to the rules. So I'm quite happy that we made that decision along with the city, and we'll probably see the rest of the townships, our 8 municipalities in the county, do the same thing. The staff at the county are working at home wherever possible. There are certainly some who can't, and my hat's off to all our public works crews, etc., who have no choice but to be out there, but we're taking every possible precaution. And of course, our paramedics, they are really going to work out there, and we appreciate the job they're doing under all kinds of challenging conditions, and we're behind them all the way. Our chief, Randy Mello, has got his eye on this job from start to finish, so we're really trying to look after them as well. But again, people are still not getting it, no matter how loud we scream, and we've got to keep this up. We do have a very special webpage on the county's website now dealing just with this subject. We have a series of audio clips. We have chit-chats with the various mayors and deputy mayors throughout the county, and our MP and our MPPs. So we try to keep the audio and video channels there alive so people can go on and hear some updated information from the county's point of view. So that's it. We are with everybody 100%, and let's just keep a positive attitude through this and try to help wherever we can. So thank you for having me.
Great, thank you very much, Warden Jones.
And now a message from Kawartha Lakes Halberton Brock MP Jamie Schmale as he details the general situation in his riding as well as how they plan to use federal monies.
Thank you very much for the opportunity to appear. I know these are trying circumstances for everyone involved, every community, right across the province, right across this country, and in fact, the world over. And this is something that is unprecedented for many of us, and governments, healthcare, retail, the trucking industry, everyone in every sector are trying to deal with this situation as best they can, provide supports for those people affected, but also ensure the public that our supply chains are still intact, that food, that supplies will still make its way to retail outlets to be sold and supplied to every individual. So I think there are a couple takeaways from this. One, governments of all levels, municipal, provincial, federal, First Nations, Indigenous, Métis, or Inuit Métis are all working together to try to ensure that the spread of this is kept to an absolute minimum, that governments are talking to the healthcare sector following the advice of health officials from every level in every jurisdiction, and that we are working also with the industries involved in keeping our systems, our institutions strong. So it's unprecedented, like I said, but there is action to keep it strong. So having said that, what does that mean? It means there is no need to panic buy. There is no need to hoard supplies. Even in Italy, one of the countries worst affected by the COVID-19 outbreak, they are still able to get groceries to their shops. The shelves are stocked, and they're able to ensure that the population has what it needs to get through this crisis. Now, a lot of countries are coming through this. Taiwan is an example of how, if we all band together, I know it's not easy, and things are going to get worse in Canada. It absolutely will. I'm not trying to sugarcoat this at all. But if we listen to what health officials are saying, wash your hands, keep your distance from others, stay home, unless there's absolute necessity to travel. And then also, if you are returning home from abroad, make sure that you self-quarantine for at least 14 days. That doesn't mean you get to stop at the grocery store on the way home. You call ahead, you get friends, you use different technology that's available to have your groceries delivered or meals, because the only way we're going to get back to what we know is normal is if we work together to get that way. So let's do it for our community. Let's do it for our province, our country, and the world. Let's get this over with as quick as possible and get back to normal. Obviously, it's not easy. Businesses are hurting, individuals are hurting, and it's going to, as I said, get worse, not just on the health side, but on the economic side as well. The governments, again, of all levels, are working to provide relief to its citizens. The federal government just passed a pretty substantial funding package. It received royal assent this afternoon, so money is able to flow. That means there is wage subsidies for employers. There are employment insurance changes that allows a wider range of people to qualify for employment insurance, including those that traditionally don't pay into employment insurance, such as those that are self-employed. So the field is widening of who can get support, because obviously during this time when governments are telling business owners to close or shut down or reduce service, there has to be some kind of compensation to ensure they are able to get back up and running when the situation returns. So I know that speaking to business owners, there are a number of loopholes in the latest package, and it's only round one. It had to be done very quickly to get the first round out. Business owners, a lot of them have seen their revenue drop to almost zero overnight. So it is extremely concerning. The loan program that was offered federally, I have heard a number of concerns on that, and I do agree that obviously business owners that are being faced with this crisis don't want to or don't feel overly comfortable taking on a loan backstopped by the federal government through the BDC or other means, taking on more debt when the future is so uncertain to pay expenses now, and then when they start back up, they're going to be further behind the eight ball to get back to where they were. That is absolutely understood and heard. We're going to work as the official opposition with the other parties to ensure that if there is a second round of funding, economic aid package, that there is some provision included so that small business owners don't find themselves forcing or making a decision either to take on more debt or close entirely, because obviously when we get back to normal, hopefully sooner rather than later, we need these businesses to come back online. So a couple of measures we as the opposition have suggested to the government, and we will continue to make our case for it. It's increasing the wage subsidy for employers. Right now it's about 10%, and it is taxable, so that's a bone of contention. Again, the first wave was just to get that money out. The second is refunding all GST remittances to small businesses that collected them for the past 6 months. Obviously, there was just a GST bill due a little while ago, I think this month. So businesses have had to dip into their cash flow to pay the government. So let's give them a bit of a break here. Let them keep that money and allow them to pay their employees or pay their rents and keep their operation going a little bit longer. And also backstopping some banks that hopefully will be able to then extend low interest loans to small businesses, because we need to get that money out. We need to get cash, liquidity into the system where banks have that ability to get more money out the door as quick as possible.
Times are tough for local business owners, and we had a chance to speak with the owner of a family-run local business, Peterburgers. Roy Asseltine details how his company is being impacted by COVID-19.
A lot of the help does seem to be going towards a lot of people. I haven't really caught too much about small businesses on what it's going to do. We have been reaching out to different companies locally that helped us at the beginning as well. And to be honest with you, we're not really seeing anything. So we are getting very nervous about that. We've been told that we can apply the same as we did for any other loan and so on and so forth. Now, unfortunately, when you've recently opened a business 5 months ago, you don't have that chunk of money or capital that you had at the beginning to say, because you've invested everything into this business, right? And anybody that's opened a business knows you don't start profiting just like that. So unfortunately, I honestly don't know how it's going to work. We have to sit back and hope, that it all comes together and that something does help small businesses survive. Because if we lose all these small businesses in town, we're going to be in an awful mess. And the other thing that we're trying to remember that we have talked to about with a lot of people is, we have the hydro, the water, there's going to be no disconnections until, July. I think it's the end of July they're talking now. Preventing evictions that's not just for people that rent homes. That's for people that aren't going to be able to pay. We have our rent at home. We have our rent at our business as well. That's all great, but in a few months, that's all got to be paid. So what happens August 1st? Is everybody just getting disconnected and you're now $10,000, $15,000 behind? So I'm seeing some things that are helping temporarily. I really haven't seen anything that's going to be a long-term help, though. It's all going to come back at some point. It's been really tough. We definitely, as a new business, we started out with a very low dollar amount. So we have literally fought tooth and nail and scraped every penny we could, put everything we had into it already at the beginning. And for us, our main goal was to make it through the winter, to get into the spring, the summer with the festival across the road, us having the only walk-up takeout window, in our little patio and stuff. So we were already struggling hard through the winter, but we had great support, and we had a little bit of a slowdown where it got really tight, and then it was kind of starting to pick up, and then this happened. And now with this, it's brought a whole new game to it. We don't know from day to day what's going to happen. We've been very open and honest with all of our customers, online, and keeping them informed where we're going. And to be honest with you, the community support has been insane, way beyond we ever could expect. So we've actually had some posts that have reached, I want to say it was upwards of around the 7,000 people mark. We had some posts that were shared between 100, 200 times. We're getting a lot of mentions from people. It's been insane. It's literally, even if we don't post something for a few hours, or even if for one day, which is unusual, people are mentioning us in so many different Peterborough sites. I'm trying to remember, Peterborough, Canada, I think, is one of them, where they're discussing everything going on in the community. And it's almost like we've brought on, quite a few thousand partners. We've been family run from the beginning. We did have a couple friends that helped us through the very first couple weeks. But it's myself, my wife, and my daughter that work there. And myself and my wife have literally, up until very recently, been working 7 days a week, doing 90 hours a week, trying to keep everything afloat. Our daughter is helping us after school. We are struggling morally with being open. We do have a takeout window. We spray and disinfect all the machines, every menu that goes out. We disinfecting the air constantly. We're practicing the social distancing, standing back away from the window. We are doing everything there is possible to do. But we are also struggling with the fact that people are leaving their houses. So on a business standpoint, we love and appreciate everything that everybody has done. But we also want to make sure that they're being safe while they're going out and doing it. Support the small businesses 100%. Definitely agree to that. But make sure you're safe doing it. We don't want anybody to be putting themselves in harm's way just to support us as well.
Since speaking with Roy earlier in the day, they have made the decision, the difficult one, as they say, to close up operations for the foreseeable future. Another industry being heavily impacted by COVID-19 is the travel industry. And today we were able to speak with Barry DeVolen from Travel Maven Tours about how he specifically is being impacted and how the industry will eventually recover.
In terms of the broader implications to the travel industry, both in Canada as well as around the world, this is going to be devastating. I think it's probably the single industry that'll get hit the hardest. There's stories in the paper today that some speculation that half the airlines in the world could go bankrupt here in the next couple of months. You can just imagine those are large businesses with huge capital assets, the aircraft. They operate on fairly small margins, and they're only successful by keeping those planes in the air full of people all the time. And so I think lots of them are going to go broke, and that's an unfortunate outcome. It's going to cost a lot of people their jobs. I think this will impact Air Canada and Sunwing and WestJet and other airlines in Canada. It will also impact similar airlines around the world. In some ways, I think the airlines from wealthier countries like Canada may do better because their governments will be in a position to help them. I flew home from South Africa on Ethiopian Airlines. Now, Ethiopian Airlines is the biggest airline in Africa. It's relatively new. They have brand new planes. It's very highly rated. But, if they're in trouble, I just have a hard time believing that the government of Ethiopia is going to be able to step in and backstop them the way that governments in Canada or the United States or Germany or places like that will be able to for their airlines. So I am concerned about big airlines, especially from less affluent countries. Hotel chains also, I think, are in a tight spot. I know I have had tours booked out of the next few months that we're canceling hotels left, right, and center. That's going to be a big impact. And finally, I think the cruise ship industry is going to probably get hit harder than anything. And this is more than a public relations blow to them. I think there's actually a fundamental issue here that I don't know how they're going to address in terms of people's concerned about being trapped, really, right, on a cruise ship when something like this goes wrong. It's ironic. We've over our lives in history class, we heard stories about ships, in the 1930s full of Jews getting turned away from Canada and the United States. And it seemed like something that could never happen. And yet in the last week or two, we have seen cruise ships around the world get turned away from ports and people kind of being trapped. Somebody called them floating petri dishes, right? So it's, I don't know what they're going to do. What I think this means for the traveling public, because this will end, we will move past this. I think people are going to be a bit cautious and skeptical about traveling at first, but they will come back. I don't see prices dropping because I think capacity is going to drop so much. So whereas right now there are, half a dozen airlines flying from Toronto to London or from Toronto to Puerto Vallarta or places like that, when this is done, there might only be one or two flying those routes. So I don't think it's going to be a big win for the consumer. It's not going to be a big win for people who work in those industries. And the other thing that really concerns me is, especially in developing countries, whether it's South Africa or whether it's Mexico or Vietnam, is all the kind of the mom and pop businesses that cater to tourists, small time operators in countries where there is no employment insurance system, where there is no social safety net to step in and support some of those people. So I think one of the greatest ironies of this whole crisis is that at the end of the day, I think the economic hardship and consequences from our reaction, which we have no choice but to do, will be further reaching and probably cause more damage than the actual virus did itself. And so, I guess on the upside, I think this will end. I think life will carry on, whether it's a vaccine or a treatment. Something will come down the tracks that will help us. But for the travel industry, this is a blow that the travel industry won't recover from for a long time, and a lot of businesses and people are going to get knocked out of the industry permanently.
Last week, more than 1 million Canadians applied for employment insurance. Coming up next, we'll hear from Prime Minister Justin Trudeau about how the country plans to work through this. Welcome back to COVID-19 Local Impact Peterborough. We now have the address from Prime Minister Justin Trudeau. Let's head to that now.
Right now, a lot of people are sitting around the kitchen table with bills, trying to figure out what needs to be paid and how to plan for the coming months. If you've been laid off, had your hours reduced, or are worried about your industry, these might be really stressful decisions. Far too many Canadians are having these tough conversations about finances and their future. Just look at the numbers. Last week, almost 1 million people applied for employment insurance. The hard truth is that people are out of work because of this crisis and worried about what comes next. So I want you to know that we'll be there to help you. Our government is doing everything we can to be there for you. The Canada Emergency Response Benefit will provide $2,000 a month for the next 4 months for workers who lose their income as a result of COVID-19. This will replace the two benefits we announced last week, the Emergency Care Benefit and the Emergency Support Benefit, in order to streamline the process. Like I said from the start, we will adapt our approach wherever needed. If you've lost your job because of COVID-19, whether you're full-time, contract, or self-employed, this new benefit will be there for you. If you're sick or quarantined, looking after someone sick, or at home taking care of your kids, it's there for you. And even if you're still employed but not receiving income because of this crisis, the CERB is there for you. An application portal will launch as quickly as possible, and people should start receiving money within 10 days of applying. I know people are concerned about delays. Families are worried about when they'll get help. It can be hard to get through on the line, and that is frustrating. Public servants are working around the clock while dealing with unprecedented demand and all of the same personal stress everyone else is facing. They will get to your application. Help is on the way. In order to speed things up, we're rapidly deploying workers from different departments to deal with claims. In the last 10 days, we've boosted the team by close to 13,000 people to take your calls, process your claims, and get you the support you need. And since last Monday, we've already processed 143,000 employment insurance claims. That means more money will go directly to people right across the country. We're working to get you the support you need when you need it. And if you're doing okay, there's a way you can help someone else, as an employer, a landlord, or even just a friend, so you can be part of the solution. It can make all the difference, because it's by working together that we'll get through this. And our team knows that. We're collaborating with the provinces and territories, as well as with First Nations, Inuit, and Métis Nation communities to coordinate our efforts and ensure that everyone is supported. Earlier this week, with the premiers, we also discussed testing for COVID-19. We know that how long you wait for your results varies widely. The premiers and I know we need to address that, and we are. This is something Minister Hajdu and I discuss with officials every day, and we'll continue doing what's needed to speed up results for everyone. But I also want to recognize the incredible work medical professionals are doing on this front. According to Dr. Tam, we're now testing about 10,000 people a day. That's a huge increase in numbers in a very short period of time. And it's because people across the country are working tirelessly to make it happen. At the same time, we're helping companies, labs, and scientific institutions produce and supply what we need most, from masks and ventilators to vaccines and antiviral drugs. We're collaborating with airlines to get Canadians home from abroad and instructing everyone that they must isolate at home for 14 days. We're also working with our international partners on this crisis. This morning, I had calls with President Sall of Senegal and President Kagame of Rwanda to share strategies on keeping people safe and addressing the economic impacts of this pandemic. I've also spoken to Prime Minister Abiy of Ethiopia and President Kenyatta of Kenya about international coordination. And tomorrow, I'll be speaking with other G20 leaders to discuss further global coordination to our response. Right now, it's more important than ever that Canadians have access to the latest news and information. To ensure that journalists can continue to do this vital work, our government is announcing new measures to support them. Minister Guilbeault will have more to say about this shortly, but I want to take a moment to thank our journalists and media for everything they do, today and every day. Above all, the most important way we can work together is by staying apart. Social distancing is our best tool to stop people from getting sick. I know people are seeing different graphs about how effective social distancing can be and new maps tracking the spread of this virus. Every time you turn on the TV or go online, you probably read something new. I know I do. And you'll want to know what's coming next. Today, I'll be getting the latest modeling from the Public Health Agency of Canada, and we'll discuss how to share this information even more directly with all of you. But you deserve the best information we've got about what's happening today and what tomorrow might bring, because otherwise, the uncertainty can be really tough, not just for your routine, but for your mental health, too. We're facing a once-in-a-generation challenge, and on top of that, you can't do many of the things that keep you feeling good, getting together with friends or having dinner with your neighbor. If you need help, reach out to your neighbor, to a sibling, to a friend, to a hotline. But do it from home. Don't go out unless you absolutely have to. If you're already following these rules, thank you for doing your part. If you aren't, know that you're making a dangerous choice. Because ignoring these rules puts every single one of us, yourself included, at risk.
One day after declaring a state of emergency, City of Kawartha Lakes Mayor Andy Letham spoke once again. We'll have that coming up next on COVID-19 Local Impact Peterborough. One day after declaring a state of emergency, Mayor of Kawartha Lakes Andy Letham addressed his constituents once again.
It's March 25th. Good afternoon. It is critical during the next couple of weeks that we focus our staffing and resources solely on the health and safety of our community. As a result, the municipality has allocated all available resources towards our frontline community response. Our staff are working day and night on this pandemic, and we ask you to do your part by holding off all inquiries unrelated to emergencies until normal operations can resume. Providing essential services will still be maintained. For the interim, any penalties incurred for water and wastewater service charges between April and June will be waived. We are also providing a 60-day relief period for tax bills, which are now due at the end of June instead of April. I want to acknowledge all of our staff and community partners who are helping maintain our services during this difficult time. Thank you to all our essential service providers, frontline responders, and those working behind the scenes 24/7 to combat this chaos. Thank you.
We'll now throw to the tail end of today's public health address from downtown Peterborough, the question period with Dr. Rosanna Salvatierra.
The line, a chance to ask some questions. Taylor, you were quick to sign in, so what questions do you have for our guests today?
Thank you, Brittany. So first question going to Dr. Salvatierra right now. The messaging has been that, people should stay home as much as possible, but we're still seeing comments from people online saying that, well, I'm sick and I've tried to be tested, but I've not been tested. And so I don't know if I have COVID, so I don't know what I should do. So I'm just wondering if you have a response to the people that are continuing to post those types of messages online, asking for advice because they can't get tested.
Well, thank you for that opportunity to clarify. If it hasn't been clear, let me make it abundantly clear that anyone who has symptoms, we're concerned right now with respiratory symptoms, but in general, anyone who's not well needs to stay home and self-isolate. And that is the only way we are going to stop this virus or any other virus that people might be hosting from spreading to our loved ones. So all of the advice that we're using for the prevention of COVID applies equally well to the prevention of other viruses and bacteria that are spread by droplets and contact. So stay home if you're unwell, self-isolate yourself. You can self-isolate yourself in your home if you have others that live with you. We have lots of really good information on our website on how to do that in an effective and safe way. And we reiterated it yesterday in the information that we provided for returning travelers. So the information is out there. There should be no doubt as to what the proper actions should be. Self-isolate. If you are getting worse, then you need to follow up. And that might be with your family doctor or nurse practitioner by giving them a call. They know what to do. And if they need to, they will either see you themselves or they will refer you on to a place where you can be safely assessed and your medical needs can be attended to. So stay home if you're ill. Do not share whatever it is you're growing, and get information from us. Call us. If people are still not sure, they can always call us back. And there is a self-assessment tool on our website that should be very helpful to most people as well.
Is it safe for people to just kind of assume that if they are sick right now, they're sick with COVID and they should treat it as such and stay isolated?
Well, that's being, I think, with an abundance of precaution. That's a safe assumption to make, even if it isn't COVID. You should be assume that it is, treat it as if it is. The last thing you want to do is give that to somebody with a compromised immune system or to your mom or dad. You just don't want to pass that on. We have lots of people in our community who are older or who have chronic underlying conditions. You may not know if your best friend has diabetes or is immunocompromised in any way. So assume it's COVID, stay home until you're better. Now, we are, with COVID, if you are tested and we know it's COVID, we know that within 14 days of the onset of your symptoms, you should have cleared it. So we can be more specific and give more precise advice to you if we actually know you're a case. If we don't know you're a case, then really stay home until 48 hours after your last symptom has gone and you're afebrile. At that point, you would be safe to then move from self-isolation to just physical distancing.
Last question then for Dr. Salvatierra, more just about how you personally are dealing with this. You're kind of at the face of the current crisis here in Peterborough, and you've been hosting these daily press briefings every day since this all has started. So I'm just wondering how you personally are coping with the current situation.
Well, it It really is an honor and a privilege to be to have these responsibilities and to be playing this role at this time. I have the great fortune of having a dynamic team of people to work with, and this is not something that only one person can address. You really do need a team effort, and I count my lucky stars each morning that I have such a great team that make it happen every day. So thank you for asking, and I just want to make sure people are aware that this is very much a team effort at Peterborough Public Health, and it starts right. I mean, every single person. We have 125 staff, and they are all tremendous. I'm so grateful to have them to be working with them.
All right, perfect. Thank you so much.
You're welcome.
Thank you, Taylor. I think we have Lance Anderson on the line who's been streaming this, and you may have some questions from residents. Have any come in, Lance, that you'd like to share with our guest today?
Nothing that hasn't already been addressed that I'm seeing right now, so I think we're good to go.
Okay, great. Thank you, Lance. So Paul Rellinger from Kawartha Now, if you've got questions for either Dr. Salvatierra or Warden Jones or the Mayor.
Yes, thank you, Brittany. And for Dr. Salvatierra, just a couple of things. Yesterday, you reported a man from Edmonton, who traveled to Peterborough from Edmonton.
Mm-hmm.
You didn't know, or you were trying to establish his contacts at that time. Has that been established?
Yes, thank you for asking. The case has 2 close contacts. So we have been in touch with both of those close contacts, and he is at home now in self-isolation.
Okay. The other thing regarding today's announcement, you mentioned the male, whose contact, I believe you said, was from outside of the city.
Mm-hmm. Yes.
You said he's in his 20s. Do you have a specific age on him?
I believe it's 28.
Okay.
So.
Okay, that's great. Yep.
Okay.
The other question I had, Dr. Salvatierra, we've heard much about who the COVID-19 is affecting, and we hear people with underlying conditions, older people. This case here is obviously a good reminder, a good local reminder that this guy's only 28, correct? And it can strike anybody.
That's true, and so it is a highly transmissible virus. We're getting to learn, as we learn more about it, it appears that people are shedding lots of virus early on in their illness. So even before they may realize that they have a symptom, that their throat is starting to hurt or they're feeling a little tired, they are shedding virus. And so there is that possibility that people who have mild symptoms are early on in their illness are actually highly infectious. So even though if you're healthy and you're well and you're young and you may not get severe symptoms, you are a wonderful vector for this virus. The virus loves you. And so important to remember that anyone can get it, and we do expect younger people, especially children, to potentially not have any symptoms at all and still be able to spread the virus.
Okay, thank you. And just one more thing, just a clarification. So from a health unit perspective, the term that you're putting out there now is physical distancing, is that right?
Correct, physical distancing.
Yes.
And we will be changing our messaging and our materials to reflect that.
Can I ask what the reason for the change was? Or?
It comes from the World Health Organization, and it's because we want to emphasize that it's the physical distancing that's important and not the social, in that we need to keep people socially connected. So recognizing the harms of social isolation when people feel isolated, are alone, that we want to protect people as much as possible. So we need to find other means, virtual means, to keep people connected through this pandemic, so that we can maintain their mental health and well-being.
Thanks so much, Dr. Salvatierra. That's it for me. I appreciate it.
Okay. Thank you, Paul. Joelle, do you have any questions for any of our speakers today?
Yeah, Dr. Salvatore, could you repeat those numbers from earlier where you said how many negatives and how many were,
Sure. So we have, up until now, we've received 186 negative results. And we still have 282 people for whom we are waiting for results. And the total number of tests that were taken were 455. You'll see that the numbers don't quite add up, and that's because we did have a problem. Sometimes the specimen containers leak, and then by the time they get to the lab, they can't be processed. So it's not a perfect number, but that gives you an idea of how many people have been tested and how many who should all be out there in isolating themselves while they wait for results.
Okay, that helps a lot. I have a question for the mayor.
Go ahead.
Okay, I was gonna ask Mayor Tarian whether there's been any further consideration given to transportation for people to the wellness center. Is there gonna be like a special transit route to take them there, or is there any special arrangement being made, or is it going to be sufficient to just have the regular route?
So that's a good question. I know that the transit, there are routes that currently run there. I would have to check with transit and circle back because we've recently changed to the Sunday schedule. I know that this is something that they're, looking at on an ongoing basis, how to make it easier, how to make sure that folks are able to get there. So I can follow up on that, but I don't have the answer for you right now.
Okay. So, Joelle, any further questions?
That's all I have for now. I'm sorry about that. I was just muted.
Okay, no worries. Thank you, Joelle. Okay, so we have Jessica here, and Greg, you're on the line. Are you okay if Jessica runs with your questions, or do you have any?
Actually, I had one question regarding the case involving the woman at the nursing home. What do we know about her? Was she a visitor? Is she an employee? And why wouldn't that be under the other health unit's jurisdiction?
Good questions. So she is an employee of the nursing home. So she would appear on what we call a line listing. So every time there's an outbreak in an institution like a nursing home, the facility starts a line listing where they include anyone with symptoms, and that work is being done with the neighboring health department. So that is outside of Peterborough. That's with the Halliburton, Kawartha, Pine Ridge Health Unit. So they are overseeing the outbreak. This individual is on their line listing, but because she lives in Peterborough, she becomes our case. So the attribution of the case goes to their residence, not to potentially where they're working.
Okay.
Okay.
Thank you, Dr. Salvatore.
Okay. Any other?
That's everything for me.
Okay, thank you, Greg. Jessica, go ahead.
Thank you.
Okay. So we've had calls about people grocery shopping. Some grocery stores have implemented, the measures they're supposed to. But people, we had Jay out yesterday shopping. People are still reaching over, even though there's only 5 people allowed in at the time. They get right behind someone and reach over. What I thought might be important is to let people know their etiquette. We all know we should be 2 meters away.
Yes.
Social distancing, which I think physical distancing
Yep.
is much better because people don't seem to understand that.
Uh-huh.
So what do you tell people, or what should you tell people when they do go out? We have to go out and shop, maybe more than the 2 feet or the 2 meter thing. What more can you tell people?
What more? Good question. I'm not sure I can answer that right now, but certainly limiting the numbers will help to avoid those sorts of close encounters. I know our inspectors are working with our food premise operators, and they are determining according to their size what is safe for them as far as how many people they can have in the store at one time. So we might see that more evidence of that in place as store owners begin to implement that and actually limit the numbers that go in. Besides that, I'm not really sure. Signage might help. I can certainly take it back to our manager of environmental health and see whether she has any ideas as to how we can ensure that the public cooperate with these measures.
Right, because grocery stores are doing it, but people aren't giving other people, the 5 other people in the store, the space that they need.
Right. Okay.
So it's like, I don't know how we can get that.
Here's your chance to make a video. Yeah.
I don't know.
Right, okay, we'll put our thoughts to that and see
Yeah.
if we can come up with something.
Okay, so another thing is people are getting restless, and you've got to, I guess, be clear when you say this for my clip. If people want to go outside, those that can go outside is what I think should be stressed. What is left that we can do? Can we go, is the Trans-Canada Trail still open? Like, I don't know if you would know that, but can we still, if we're going out for a walk, or can we go for a jog, or what is left for us to do and is safe to do outside?
Well, I think we do have some wonderful places where people can walk or run outdoors, and if they can do that and still maintain their physical distancing, then they should take advantage of it and try and get outdoors once a day, perhaps limit how many times, but going out, making sure they do get some physical activity. The playgrounds are still open, and I know that the city is putting some signage in order to help direct people on how to use those in a safe way. So if people have backyards that they can use, I know snow is going, there may be more space around the home where people can be outdoors. But other than that, I think those are really the options. I'm wondering if the mayor has anything, or the ward, and if you have anything to comment as far as our trails open and any advice as to how people can be using those in a safe way.
Yeah, I mean, I think as the weather gets nicer too, we've seen, I mean, on the weekend, on Sunday, I was out walking the dogs, and folks seem to be quite aware, passing each other with safe distances on the sidewalks. I know that we've had some concern about, people still playing basketball and having those kind of group activities, which obviously can be problematic. Even if you're young and healthy, we don't want people being that close together. But certainly, the trails are still open. Sidewalks obviously are still open, and we just ask people to be conscious of giving one another, a good amount of space. There's a lot of folks too who, if they don't have a backyard or access to, private outdoor space, then we want to make sure they're still able to get fresh air. And, we're very fortunate to have great trails in the river system, and so those are still available. Again, we're asking people not to go out unless they have to, recognizing that a lot of folks trying to contain particularly young kids indoors all day isn't the easiest. So it's about making sure that you're practicing that physical distancing and in a safe way. But that's pretty much it. We want people to, the playgrounds are, will be, as we said, there'll be some signage. And again, it's just respecting each other's space and staying physically away from people, but still saying hi and waving across the road.
Yeah, and I guess from the county's point of view, we have lots of wonderful outdoor space, and this is being managed by each individual township, of course. I know in my own township at Dummer, we've seen some of our children's playgrounds with just way too many people, and you would never know that anything was wrong. So we've had to put notices up and even close a couple of the playgrounds because people just don't seem to be listening. But no, I mean, we certainly encourage everyone, go for a walk, keep that physical distancing. I walk the dog up the road every morning, and I think most people are respecting that distancing. But we can't be expected to stay in 24 hours a day. So I do hope people will adhere to the rules. And let's get some.
Thank you for watching COVID-19 Local Impact Peterborough. I'm Dan Malta, and we'll see you tomorrow.